Go like this. Err.
I can't because I don't have teeth up here.
Well, we got a call about two boys that needed a home. The 2-year-old, he had just, his teeth were rotted away here in the front, like up to the gum. We did come to find out there was like Mountain Dew and soda in a bottle that would be given to him. So, and then the 4-year-old, his front teeth were just like black, like just completely black, rotted away. And the dentist said that teeth would need to be pulled, capped. The one where his teeth were kind of rotted away up to the gum, that they would have to cut the teeth out. So they said they would have to go under general anesthesia.
So now we're talking a surgery.
Yes. They initially did not want to shell out the money for an anesthesia.
So at 3 and 4, they were saying that they weren't going to pay for the anesthesia for 6 teeth to be removed.
Yes, that's correct.
And so what did you say about that?
I didn't know how they expected them to sit through something like that, being that young. I just remember it kind of as a traumatic day because you go in there and, obviously they're professionals, but just I feel like with the Medicaid system, it's more like a factory line. It's kind of get them in, get them out. They went under surgery. We did them both on the same day. They went under, and within like 10-15 minutes of them coming out of anesthesia, we were in the car heading home. After the anesthesia wore off, they took him into a room. When they woke up, they said, give him a little bit, just make sure, there's not extensive bleeding, then you can let him up in the car and go. And so, we're heading home with 2 kids who are screaming due to the, coming out of the anesthesia. Everyone reacts differently, but kids tend to act more severe, so.
What would you say the barriers were for you trying to advocate to get help for your children, given the current Medicaid situation?
Well, there's not much help. There's not really like, oh, you definitely call this number for this, or you definitely call this number for this. It's kind of like you're just thrown into it. And like, here's a general number to call, and I'm going to transfer you to like 5 different people. And we even struggled just to get a copy of their Medicaid card. Like, we had to use a form given to us by Children's Services that had a DVN number on it to use at doctor's appointments. And we still struggle to even get like updated Medicaid cards, because their health insurance may change every year, and sometimes we just don't even get one, and it's such a pain to call and say, hey, I need a card for health insurance card for my kid. So it's just there's just not a clear way to go about things. Like, if I call my doctor, it's very easy to get the help that I need, but for the kids through Medicaid, it's an extremely difficult time. Like, I have to set like a whole couple hours aside just to do the research into that.
I'm Dr. Gregory Castellone. I'm the director here at the Lincoln County Health Department Dental Clinic. It was established in about 2002. I've been a volunteer over the years and been the director, been a volunteer, but now since I retired, I'm working here 2 days a week, and we're trying to take care of the needs of the underinsured and the underinsured, specifically like Medicaid. Medicaid is hard to find providers because the state pays very little. If we were an FQHC, the state pays 90% of UCR, but when you're just a regular dentist or just a clinic like this, they only pay 30%. So funding is very difficult. So if the state of Missouri could up their fees a little bit, it would be a great help. So over the years, we've seen lots of kids with really bad teeth, but it seems like we're starting to see less and less of the rampant caries in kids. Parents are getting the message and they're trying. It's been rewarding to work here all these years and to see the improvement in their health, but there's still a lot to do because there's so many people that just cannot afford to go to private practice and get their work done.
Some of the barriers that we see here in Lincoln County for our families is Medicaid providers. They are dropping like flies very quickly. We are down to only our agency here in Lincoln County being able to see Medicaid adults and children. A lot of our specialists are starting to no longer accept Medicaid patients. So those specialty services such as endodontics for root canals and oral surgeons to see patients for removal of difficult extractions of teeth. We're finding that our closest resource is either Columbia, which is a 2-hour drive, or downtown St. Louis, which takes a little while for them to get seen in that facility. So our goal would be to work towards securing more providers. One of the reasons why I'm hearing that these providers are dropping is because of the reimbursement rate. Obviously here in Lincoln County, our Medicaid reimbursement is not substantial in any way. We could not fully sustain our clinic 100% on Medicaid reimbursement. It takes a lot of training and education for the staff members to know all the ins and outs of the billing procedures and know the guidelines that Medicaid requires for certain procedures, as well as the prior authorization. It doesn't, prior authorizations with Missouri HealthNet all have to be done by paper. Most of our private practice dental offices are all moving to electronic. So there's a lot of little things that add up to make it a much more complex system than what a private commercial insurance plan.
Is there enough dentists accepting Medicaid to see children at the age of 1?
I don't think so. No, definitely not. We here at the health department, we've lowered our age to basically birth and on. So basically when they get their first teeth, we can now see them. A lot of parents don't really take their kids to the dentist until they're older. I know when we ask them about dental care, the majority of them have not seen a dentist at all.
Okay.
So
And the
it's gotta be
recommendation
done.
is to be at 1 year of age.
Mhm.
So tell us a little bit about the Preventive Service Program and what you're doing across the state of Missouri.
So the Preventive Services Program is a program that's for children in the state of Missouri. Any child can participate, infant to 18 years of age. The thing that makes our program so unique, it's a community-based program. So the success of the program is based upon volunteers. When it started 13 years ago, we screened about 8,500 children in the entire state. Last year, our numbers are at over 92,000. So that's all for volunteerism, and that's the amount of children that we're touching with our program, and those kids are getting that preventive aspect of fluoride varnish. And of course, we'd love to see fluoride varnish painted on more. Best way to get fluoride varnish, of course, is systemically by drinking water, which is why we advocate for drinking fluoridated water at a very, very young age, even during pregnancy.
Right.
But still advocating drinking water, because when we see children as early as kindergartners, their permanent teeth are forming. So keep drinking that water to help make them stronger.
Is the drinking of bottled water fluorinated?
Most of the time it's not.
There's probably a little trace of it, but
But very
it's
little?
Very
very
little.
So really it's the tap
It
water.
is the tap water.
So if in communities where the tap water isn't palatable, we have an issue.
We do have an issue. And as you know, in a medical practice, there are times when a particular doctor or nurse practitioner will recognize that community doesn't have adequate fluoride or the water's just not tasty. They could prescribe a fluoride supplement that the child could chew or dissolve in water so they could drink it. In addition to they could paint fluoride varnish in a medical practice. We would love to see that happen, because those pediatricians, those nurse practitioners that see those babies, the first tooth that comes in, start telling mommy, let's put that fluoride varnish, let's protect that tooth right now. And I really think that would be advantageous to see decay decrease immensely in the state of Missouri.
Sure.
So tell us a little bit about what the Department of Oral Health and Senior Services does in the state of Missouri.
So what we do, first off, what we had in 2004, we did a Show Me Your Smile survey, just to assess the dental health of kids in Missouri. And from there, we saw a definite need. We have decided to go out and do screenings to the different schools that would like to participate with us. We do screenings to assess their dental health, and then we also apply fluoride varnish. That's twice a year. And that program has ballooned so much. Just recently, we were awarded 2 new grants, one from CDC and one from HRSA. Our CDC grant is to help to promote the importance of community water fluoridation. Currently, Missouri's water fluoridation rate, there are about 75% of our population on fluoridated drinking water. And we would like to increase that because obviously fluoride in the water at the optimum levels is a definite positive. That is a very good thing for people's overall dental health. The other thing that we're working on with CDC is improving the sealant rate in Missouri. We have a couple contracts that we are working with some local public health agencies to go out to different schools and via teledentistry to apply sealants to kids. A lot of Missouri is in a dental HIPSA, healthcare provider shortage area. I think it's like 86% of Missouri is a dental HIPSA. And teledentistry is a great way to reach those kids who can't reach dentists, who aren't close to a dentist. You know, they might have to drive an hour or 2 hours to even see a dentist. So teledentistry is a great way to bring dentistry to them at their schools where we know that they will be.
With teledentistry, you're able to use the technology we have available today, such as electronic health records, cameras, intraoral scanners, and x-ray equipment, to then store the data and send it to a dentist who might be 30 to 130 miles away. It could be any allied health professional that can submit that data to the dentist. So in a hospital or primary care office or oncology department, being able to communicate using today's technology can lower those barriers so that we can get patients into the appropriate provider so they can get the care that they need.
We've had a lot of instances with teledentistry where we were able to just access kids who would never go to the dentist, especially in rural communities.
What did you find their teeth looking like?
It just really depends. I would say the most decay that I found was in the Head Start setting, and you wouldn't believe that you would be able to take oral pictures of a 3-year-old, but I've done it a ton of times. I've done it. I mean, they're not as difficult, and those are like a population that people don't want to touch, you know what I mean? Mm-hmm. Sometimes they even, like a general dentist won't even see a kid that's 3 or 4, and they have a mouth full of baby teeth, and a lot of parents have the ideology or the misconception that those teeth are not important, and those kiddos are in pain, can't really express what that pain is, you know what I mean? So those were some of my greatest cases when you see like a 3-year-old and their mouth is full of decay and being able to help them out. Nurse practitioners say, hey Tiff, I got something I want you to look at. I go and take a look and they say, okay, come to my room, I'm gonna take an x-ray, I'm gonna take a picture, I'm gonna submit it to a doctor. The doctor says, the nurse practitioner might say, I don't know if this is plaque or candidiasis, I don't know what this is. And I don't even really want to look at it, you know what I mean? Because, I don't,
Well, she had an expert to grab.
Yes.
Right?
So she grabs me and I'm like, okay, I have an idea that it might be this. I'm going to consult with the dentist. I will, we had a chat system that we can talk to dentists remotely. And I say, hey, can you look at this x-ray really quick in this picture? And they say, hey, yeah, that's that. I'm going to give you antibiotics. You schedule them for an appointment, follow-up appointment. at this
There you
clinic.
go.
Yeah.
So it's about time we bring them both together.
Oh yeah, for
Thank
sure.
you so much for
Yeah.
talking to us today.
No problem.
That's great. All right.
Okay, thank you.
Thank you. You gave us great information.
Hi, I'm Carol Berger. I'm a family nurse practitioner. I've been a family nurse practitioner for the past 11 years. 7 of those years I worked in rural health, and I saw the devastating effects of oral disease in children under 5 years of age. They had cavities, they had pain. Sometimes you couldn't even touch their teeth without that hurting. We, in my own studies, sent 25% of the children for oral surgery because their disease was so severe. And what that means for a child who's 5 years or under means they have to be put under general anesthetic, which comes with risks. And after these teeth are pulled, they have to live with the absence of their teeth for years before permanent teeth come in. If they have 4 teeth on top and 4 teeth on the bottom removed when they're 2, it's going to be 4 or 5 years before they get teeth back. And that is devastating to them. They have to eat differently, they talk differently, they have speech issues. They have a social stigma of just not having their teeth for that long. It is something that we can do in our practice. We can help with this. As medical providers in family practice and pediatricians, we can add examining the mouth in part of their well-child visits. We see them at 3 months, 6 months, 9 months, 12 months, 18 months, 36, 24 months, and 36 months. That's 6 times. But we can also look at their teeth. We can take a simple brush, and as you've heard in this documentary, fluoride varnish works. It reduces cavities. It strengthens their teeth. We can apply this in less than 60 seconds. It doesn't take any time, and the state reimburses us. Oral disease is the most preventable chronic disease of childhood. And together, we can work with the dental community to help make a difference in a child's life.
Can you go like this? Like this? There you go. And smile real big.